If you have back pain or sciatica and squats hurt your back, if you can't do that, try no weight at all, just body weight. If you can't do that, try assisted. If you can't do that, you can try assisted with a ball against a wall. If you can't do that, we can just do wall squats that don't move your spine at all. If you can't do that, we mimic the position with things like child's pose. If you can't do that, we can regress to dead bugs, core stability, and gentle hip ranges of motion that don't bother the spine. And if you can't do that, we can do gentle movements through the spine to loosen things up. I'm Dr. Anthony Davis. I empower people with back pain and sciatica to reclaim the active life they love. If you want to know more, you can always watch the masterclass. The link is in the description. Just because you have back pain or sciatica does not mean that squats are dangerous. So many of my patients have been told that if you bend your spine, if you squat, especially if you put weight on your back, that terrible things are going to happen to your discs or your ligaments, or you're going to pinch a nerve. So they walk around like a robot without moving their spine, and they do everything with perfect form, but they never move their spine. If your spine wasn't meant to move, why do you have so many joints in it? It would just be one brick of a bone if it wasn't supposed to move. And if you think you should avoid squats for the rest of your life, how are you going to get up and down out of a chair or off of the toilet? How are you going to pick things up off of the ground? How are you going to tie your shoes? Wear shoes without laces for the rest of your life? I'll show you how to ease your way back into squatting safely without aggravating your pain in just a second. But first, you need to understand why avoiding squats and avoiding moving your spine is one of the worst things that you can do. Let's use a different example. Pretend you had shoulder pain and the doctor told you you should never move your shoulder outside of a perfectly neutral position, otherwise bad things are going to happen. So now a year, 2 years go by and you don't move your shoulder at all. So what do you think is going to happen the first time you try to reach over your head to grab something? Of course it's going to hurt. Why? Not because reaching over your head is dangerous, but because you haven't done it at all for years. The same thing happens with your back. The muscles, tendons, ligaments, bones, joints, and discs that your back is made of need to become tougher and more resilient so that you can squat and lunge and hinge and do normal life without pain. So the longer you avoid working your body, it atrophies. The tissues become thinner and less resilient. And over time, you've atrophied so much that now it's a self-fulfilling prophecy, where because you never practice squatting, now if you do have to squat in real life, you hurt yourself. But that's because of the atrophy of all of your tissues. So we need to, over time, make you tougher and stronger, going from this to this to this, and eventually make you stronger than you were before the injury, make your muscles, tendons, ligaments, bones, joints, and discs even tougher. So even if you have to pick up something heavy in your daily life, you can do so safely without getting hurt. So I'm going to show you how we get people back to squatting. It doesn't have to be heavyweight, but you have to be able to do normal daily life. And please keep in mind that even though I'm showing you a squat progression, in real rehab, there is no single progression that's going to magically fix everybody's problem. What we have to do is give you a comprehensive plan that addresses all of your joints, all of your major ranges of motion and muscle groups in functional activities, and ease you back into normal life in a comprehensive way. What I'm saying is there is no magic exercise, but this is a really solid progression to get you back to squatting safely. As long as you're using it alongside lifestyle change, better sleep recovery, nutrition, stress management, and a more comprehensive exercise plan. Rather than starting from hard things and easing off, I like to start people from the easiest thing and work our way up. Let's break this down. In order to squat, we have to be able to move our hip joint and keep some strength and stability through our midsection. So the first test is, can you lift your legs and hover them and set them back down? If that's too painful, then we just need to work on belly breathing. So we can always start with just gentle belly breathing. Second step, right, we hover and hold, and we're trying to maintain a somewhat neutral spine. We're not looking for perfection. We're looking for pain-free, and can you actually do this? Step 3 is, can you move one leg at a time without creating symptoms, and while maintaining some type of integrity through your core? Step 4 is making it a little bit more difficult by turning it into a full dead bug, shrug. Step 5 is mimicking the position of a squat with a child's pose. If it hurts with your knees together, try knees wide apart like you would actually do while you're squatting. One of the issues that people encounter at this point is that their back tightens up, their muscles spasm because they're overprotective in this position. This is where child's pose and things like cat-cows are a really good opportunity for you to use deep belly breathing to calm your body down so that you're not being overprotective. Now that we can move from the hip joint, the question is, can we actually use our legs? This is where I really like wall squats because your back is fully supported by the wall behind you. And you can just do partial depth. You can lower and just bend your knees a tiny bit. And you can just hold this. You might actually have to hold this for a whole minute or 2 minutes or even 3 minutes just to feel a burn in your quads. But the cool thing is it uses your back zero. There's no effort from your spine. And then over time, all you have to do is lower your depth. So you might start with just a slight bend in the knees, but over weeks, you might be able to bend a little deeper, bend a little deeper, bend a little deeper. And eventually you might be able to do a full depth wall squat and hold this and then just work on increasing your time. If you can do this for a full minute, it's time to do something harder. Now it's time for assisted squats. A lot of people like to use a ball against a wall. This is a great option. Remember, you can go with partial depth or you can go with full depth or anywhere in between. But eventually we want you to hold on to something like a banister or a door frame and do squats. Remember, you can do partial depth and then work your way down over weeks. This is a great way to do it because you can use 100% effort from your arms and literally pull yourself up with your arms. And over time, we go from 100% with the arms to, just 30%, to just eventually just using it for balance. And if you can do assisted squats, then you can at least do a partial depth bodyweight squat. And then you just work on the depth over time. And then you just grab some little 5-pound weights and start to add a little bit of weight, or just hold onto a backpack or hold onto a water bottle. Once you get to heavier weight like this 45-pound weight, it's a lot harder to hold it up here because you have to hoist it. So for many people, we hold it between the legs like this and then work our way up. And if you can do 45 pounds with a dumbbell, then you can probably do a barbell front squat because a standard barbell is 45 pounds. And then we can work our way into a back squat as well. Pro tip, allow your feet to be out and even turn out a little bit. That's okay because it makes room for the pelvis to drop down, which means that as you get to the bottom, you're less likely to round significantly. Not that it's dangerous to have a little spinal flexion. It's actually impossible to avoid spinal flexion while you're squatting. But if you're sensitive to it, then allowing a wide stance can be helpful for your symptoms for a lot of people. And then progressing a barbell squat is easy because it's always the exact same movement. You just get used to these little 5-pound weights, throw one on each side, and then get used to squatting a little bit more weight and a little bit more. And if depth is important to you, you can do a box squat like this, and over time, lower the box a little lower. Obviously, you want to make sure that you can do that with body weight before you could do that with a barbell. But then you can use that box at the lowest setting, and eventually you can get all the way down into a deep squat with some weight. And at a certain point, you're no longer doing rehab, you're just training, and you can do this for the rest of your life. Remember, if you want to return to an active life, it's not just about one exercise, it's not about magic exercises, it's not about fixing your posture or your alignment, it's about overcoming the fear of doing movements, making sure you have good recovery, sleep, stress reduction, and nutrition, and then using graded exposure in a comprehensive way for your full body to return to real activities that you care about. If you want to know more, watch whatever video is appearing on your screen right here, and I'll see you in the next one.